All right, so again, thank you all. My name is Mona Farley. I am a student, a senior a biology major. I am also the president of Active Minds. Mental health discussion is very important, so I really do appreciate you all registering and joining us today. I'll go ahead. Claudia, you can go ahead and introduce yourself.
Hello, my name is Claudia, and I'm here with my partner Gladys. We're the student leaders of the Support Each Other project, and we're so thankful to be able to partner with Active Minds to host this event. The Support Each Other project has been made possible through the UHD Center of Community Engagement and Service Learning Department. They were able to award us the grant, and through that, we were able to help spread the issue about mental health awareness. We really appreciate everyone who has helped us and Active Minds on this event. And we want to give a special thank you to the UHD CSL department for giving us this grant and for funding us. Please enjoy this event and feel free to ask any questions. And also at the first 30 registrants in the event, you will be contacted via email with details about your goodie bag and the pickup location as well.
All right, and if you want to hear more about Active Minds and what they're about, I will post a link in the chat. Hopefully that later on you'll be able to go over it and just to learn about Active Minds. Now, I want to bring up our own panelists. I am very grateful that they're able to join us and they make this event possible. You can go ahead and introduce yourself.
Okay, so was I first, Mona?
Yes.
Okay, all right. I'm Dr. Liza Barrows Lane, and I am a social work professor here at the College of Public Service. And some of the work that's relevant to what we're talking about here in mental health is I've had counseling experience working with behavioral health in a medical setting. So working with women who are kind of dealing with substance issues and how that relates to their behaviors and their mental health. So it's kind of that connection between behavior and mental health. And then also I've done trauma therapy in a private practice setting while I was under supervision. So I'm really glad to be here. Thank you for having me here.
Thank you so much.
Hi, I'm Heather Goltz. Hi, everybody. Heather Goltz. I am also social work faculty here at UHD. I, like my colleague, Dr. Barros Lane, have functioned in medical and private practice environments. I specialize more in oncology or cancer-focused social work and sex therapy. But I also, like my colleague, work with individuals with a number of different mental health disorders or even adjustment to problems of daily living. So thank you for having me.
Hi, everyone. I'm Dawn McCarty. I'm so happy to be here and so grateful to spend this time with you and my colleagues. We don't see enough of each other, like many of you don't see enough of the people you care about. So I'm happy to be here for this hour with you. I'm the director of the social work program here at UH Downtown and one of the founding faculty members. I've spent many years working with new immigrants to the country. And so I have some specialties in that sort of adjustment and trauma, and also much work with people with anxiety disorders, which we're going to get to talk a bit about today here. So I'm excited about that. Thank you again for this invitation and welcome everyone.
All right, so thank you. Oh, I'm so sorry.
Good afternoon, everyone. I am Tamara Davis. I am one of the counselors here in the Counseling Services Department here at UHD. I have some experience working with college students for about 5 years now, but I've also worked in the private practice settings as well as in behavioral health settings as well, doing tobacco cessation. So I have a long range of areas in which I've worked, but I've kind of found my niche with working with college students. So I am here as your representative from the Counseling Services Department today, and thank you, Active Minds, for having us.
All right, I think now I can come back. Thank you so much for joining us. And I want to also thank our audience for being here today. So we'll begin with our first question, and just to, get everything together. With everything that's happened over the years, like the pandemic and just the challenge that, we went through, it's just, and a fact that, there are certain things that no matter how prepared we are, there are certain things that we cannot anticipate. So, and all of those things kind of affect people's mental health, and for which I feel that, it's really important that we discuss it, especially, on campus and students, and so they can learn from experts, So we'll begin with our first question, and the first question is for Dr. Goltz, and that is, we'll start out by, if you can explain to us what mental health is and how does it affect individuals, and what is the importance of having this discussion.
Oh, wow. So mental health really is about our emotional, our psychological, our social, and relational well-being. It really underpins everything about us from birth until the end of life. It affects how we think, how we feel, how we behave. And, there's a lot of factors that really play into our mental health. There's a genetic component or a biological component. Our neurochemicals, that our neurotransmitters, our brain chemistry. My colleagues are very skilled at what we call trauma-informed therapies and even trauma-informed education. So our life experiences, whether we've experienced child abuse or domestic violence, traumas of some sort, can feed into our mental health. And even, our family history in terms of family dynamics and family alliances, or perhaps if we've ever been scapegoated within a family group or a friend group, all of these things feed into our mental health. And so, it's just one of those things that we don't talk a lot about. And of course, my colleagues will have tons to say about that, but just broadly, it is a major part of who we are as human beings.
All right. Thank you so much for that response. One of the goals for me is that, no matter what your knowledge is, on mental health, that you'll find something here today interesting, and whether it's for you or for your family member, you'll learn something new and that you apply it to your life as well. So we're gonna move on to our next question. And this question is about anxiety. Again, the pandemic really did a lot. So, and the resulting economic recession, it kind of affected a lot of people mental health. And then also with those that are really, and kind of like those that already have those issues, or even more, experiencing those mental health issues worse. So my question now is for Dr. Lane. If you can please go ahead and explain to us, what anxiety is and how can people really recognize it, and how does it affect individuals? So I know that's like So what is anxiety, right? How does it, how can we recognize it, especially, as students, as whoever, whatever it is, how can we recognize it and to help ourselves come back again whenever we experience those things, we're able to bounce back up again. So that is, thank you.
Yes, absolutely. Absolutely. This is Dr. McCarty, and then I'd like to give you like a little framework here, just to bounce off Dr. Goltz's just sort of perfect overview of why the importance of what we're talking about today, the significance to our lives and well-being, right? And then Dr. Goltz and Dr. Lane, and then Ms. Davis chime in, because we're all kind of experts on student anxiety, right? We're kind of, we see a lot of it. I know you feel like you're on your own in this world. You're not. We're here for you. We see you. We understand how anxiety can either be a good force in your education, or it can, you sort of hop over that line and it becomes not so helpful to you. So just very briefly, anxiety is a normal human emotion, and it's kind of useful, right? It helps us get off the couch. It helps us take care of children when we don't really feel like it. It helps us, yes, keep moving forward when it helps us study for that test. And so anxiety is a normal emotion that's helpful to us for the most part. It makes us a little nervous sometimes, and that nervousness or that eagerness to get something done or to move forward or to achieve a goal is a good thing. It frequently, though, especially now in COVID, right? Or maybe like Dr. Gross was talking about, it could be genetically sort of predisposed in some ways to be. I come from a long line of anxiety disorders. I tell everyone that, a long line. And so I've got a bit of genetic predisposition myself. And so that's okay. I'm just aware of that. We pay attention to it. So what happens with sometimes that anxiety, when it gets too much, right? And the discomfort is no longer motivating, but kind of stifling of your capacity. And then you move from that sort of like nervousness or like, oh, I got to get that done, to fear and being fearful and it not being able to motivate you, but to keep you from doing what you need to do, to be overwhelmed by it, right? So that's what we want to look for. That's where if you're like you've got so much anxiety, so much fear that you're maybe not eating well, you're not taking care of yourself, you are too nervous, you're trying to use other things to manage your anxiety that also don't help you, right? We'll talk about that in a minute. So when you're fearful more than not, and when you find yourself in a place you can't act because you're overwhelmed, maybe you're having some panic attacks, right? That's part of it. You're not in a place where that's where you need to seek intervention. That's where, and the good news is that there's so much treatment for anxiety when it's to this point. At least 30% of Americans get treatment for anxiety disorders. Trust me, that's a lot, right? We've got this down. There's so many things you can do at all different levels. Let's talk about 3 quick things, okay? And maybe if you've got some questions, just take a breath. Our bodies know what to do. Our body knows how to calm itself down. So let's do this with me real fast here. Let's just take a minute, just 1 minute, to take 6 deep breaths. I know my colleagues can use this right now. We've been running all morning, haven't we? Let's take a minute, just everyone with you. So in through your nose and out through your mouth, just 6 breaths. Close your eyes, that will help. And here we go. In 1. Push your breath all the way out. Try to pay attention to where you're holding tension in your body. I hold it in my stomach. So right now I'm trying to relax my stomach. So in through your nose. Relax your shoulders. One more breath, deep breath in through your nose. Now through your mouth. Okay. So we can do that 100 times a day. Just stop yourself, pay attention to your body, relax those parts you've got tensed up all day long. Just take a minute. The second thing we can do, easy peasy, is just pay attention to what we're putting into our bodies. Anxiety is kind of normal and natural, but also our ways to cope with it are just normal and natural. So a couple of things you might think about is how much television you're watching. TV is a lot of stimulus. What you put into your mind stays there, all right? So think of it as like a recipe you're making. So think about the recipe you're making in your brain. So think about the TV, cut it out a bit. See if that helps you stay more centered and less frazzled, right? More able to concentrate. The second, and this is super unpopular, but if you drink caffeine, watch your caffeine intake. Caffeine is an anxiety. I know I wasn't gonna call you out, Dr. Golds, but oh, look at Ms. Davis. Yeah, not calling you out. Just think about it. Be mindful of how much caffeine you're taking in. Caffeine is an anxiety producing drug. When you look it up, it says anxiety producing drug. So watch that. I have to really limit my caffeine. And so I've come to peace with that. The second is like how we respond to anxiety in other ways, like alcohol or other drugs. I promise you at 5 o'clock, I'm going to have a glass of wine. Everybody knows it. So there's moderation, right? But just think about if you're using other drugs to help you manage your anxiety, there may be better ways to do that. And then think about exercise. I know that seems a tall order right now. If you're not a freak person who gets a lot of exercise, just get outside and walk around your house or your apartment building. You just do something 5 minutes. Actually, the new research, by the way, on heart disease and what's good for your heart is about 12 and a half minutes. That's it. I can do anything for 12 and a half minutes. Is it 12 and a half or 19? Okay, maybe my brain is a little frazzled right now. So if it's less than 20 minutes, you can do anything for less than 20 minutes, right? You can walk around, you can walk up the hill at school, get your friends and your classmates to walk down the hill and come back. So think about that. All right, I'll turn it over now to our moderators.
All right, thank you so much, Dr. McCarthy. So if the panelists, if anyone have anything to add on there, the floor is open. I think I didn't do it in the first question, so I apologize for that.
I thought it was helpful just having that breathing exercise right now, and it really is. I needed that because even what we're going to talk about today is anxiety provoking for me, and having to get on here and is the webinar going to work and all that stuff. And it's so, I love how simple it is. And it really is, we're not trying to say that having anxiety disorder or having anxiety is a small thing, but there are such small things that we can do to kind of help ourselves calm down. So I really appreciated that point you made, Dr. McCarty. And there's another part that I was like, oh yeah, it's just like that drinking caffeine, like that. And I know that coffee and caffeine, I think sometimes those drugs that we use help us to manage how much work we have. You know what I'm saying? Like needing to drink coffee, needing to drink wine, needing to, and I like to eat too. So that's also the sugar drug, So, but I think too, that if that, excuse me, if all of that was taken away and we have to survive our very difficult lives without that, right? I think that it also says something about how much we've taken on, and I think that when you take that crutch away, it can really, and sometimes you don't have a choice. Sometimes life just hands you something, you have to just deal with it. But I think that where we can have agency to look at, what, I can really rearrange. I can get rid of this. I need to stop this relationship. I need to, kind of set boundaries to help me manage my life and to not have so much anxiety. So I feel like that was something that came up for me too.
Similar here. I just want to piggyback on the caffeine part a little bit, simply because it is absolutely correct. Caffeine can definitely be an anxiety-inducing drug. If you notice, it may make you start to feel a little bit jittery. Then once you get to that point, then yes, you probably have had a little bit too much caffeine. You have to kind of bring it down. So it's very important to be able to be aware and to be cognizant of your caffeine intake. And the unfortunate part about it is that we intake caffeine as a way to keep us awake, keep us alert so that we can be more productive. But another way that we can maybe reduce the amount of caffeine that we're intaking that's inducing anxiety is by getting the rest that we need. So we need less caffeine, which lack of sleep can also be anxiety inducing. So getting enough sleep, reducing caffeine are all of those things that you can use. Again, those small things. Anxiety can be a big thing, but there are very small things that you can implement into your day that can help you to reduce those feelings of anxiousness.
I just appreciate so much of what my colleagues are putting out there. This really good knowledge for everyone. And we all need reminders, in thinking about and reflecting on what they're saying. Remember, Dr. McCarty is giving you strategies for staying in the here and now. Dr. Barrows-Lane and Ms. Davis are talking also about what, and everyone about what you put in your body, and how anxiety, really often is about, fear of future potential outcomes. Remember, when you are taken out of the here and now, out of the present, and you're fearful of what's going to happen to you in the future, you're really going back into the deepest part of your brain, the most primitive part of your brain. And that part of your brain only knows three things. When it feels threatened in some way, and anxiety and fear are how you can feel threatened, it knows fight, flight, or freeze. And that, and so when you come into the here and now and use those exercises like Dr. McCarty is talking about, that pulls you into the here and now so that your brain and your body can reset. And so these are good strategies that you can use in your daily to pull you back into your body, reset your brain. So definitely look into doing things like that. And she's right, 100 times a day if you need to.
All right, thank you so much, Dr. McCarty. I believe you answered the question that was in the chat also, so I really do appreciate it.
Yeah, so before we move on real fast to bring
Okay.
up, and I am happy to try and get the link while we're here today, is to think about a meditation practice. I know that sometimes people think, oh, that's beyond me, or that's beyond my worldview. It's not. It's just exactly incorporating all the things we've been talking about here about awareness. Dr. Gold said it perfectly about being in the moment. You can't be anxious when you're in the moment, right? It's not possible. You're not worried about the past. We can't change none of that, right? Leave it back there. The future, you can't really, know. And so it doesn't help you to be anxious about that. But in the present moment, you're not anxious. And that's what we need to bring ourselves back to as much as we can throughout the day. A meditation practice and learning some meditation skills will help you. I'll put a link for a beginners group that's very easy to access. It's wonderful. I've been a part of for 15 years into the chat.
Thank you so much. Thank you all for the response. So our next question will be on PTSD, trauma, and the misinformation surrounding it. So the question is, so we just want a little bit, to talk about PTSD and just the information surrounding it and how it affects individuals. Fantastic.
All right, so I think that's my question there, and of course people will jump in after I share. But I think it was interesting. I think jumping off of the anxiety discussion, of anxiety is about, you're fearing the future, you're fearing something, or reliving something in the past, or thinking about something in the past. And trauma, first of all, it's like, what is a traumatic event? And it's, trauma is about re-experiencing things that happened in the past now. And so when you're in the moment, sometimes when you're dealing with trauma, and I can tell you about my personal experience with that, it's so difficult to be in the moment, because in the moment is terrifying. You're having these flashbacks, you're having these memories, so I want to kind of backtrack a little bit to talk about, what a traumatic event is, right? So a traumatic event is really hard to pinpoint. It's really hard to specify, because it entails having a sense, like experiencing something that gives you a sense of horror, feeling helpless, being exposed to serious injury or being injured, or a threat of death, or actually witnessing death. And actually that's a very specific, I mean, if you look at just sense of horror and helplessness, there's a lot of things that can make us feel that way, like being chronically bullied, when we're growing up. Those kind of things can also create a sense of helplessness, and then, kind of an experience of trauma. And so I guess what I want to say is that, we hear about PTSD, post-traumatic stress disorder, and that is an actual diagnosis, right? And it's a diagnosis for a very specific, kind of set of circumstances. But trauma can be an experience of a much wider set of circumstances, right? So you could have PTSD symptoms and not have a PTSD diagnosis. And I just want to say that because it's important. Sometimes when we look, when I've looked at the PTSD criteria and I've been feeling some of these symptoms, just like, well, I didn't at that time did not really fit that criteria, but I'm having this experience of trauma. So that's what I want to say, just kind of like what might be a terrifying experience for one person may not be a terrifying experience for another. So that's the first thing, is that I think a misconception around trauma and PTSD is like, well, I shouldn't be feeling this way because what I went through wasn't as bad as what someone else went through. But the point is, like, it really depends a lot, like, on your age when things happen to you. So being left home alone is a different experience when you're a 6-month-old than when you're a 12-year-old, right? So then that could be a traumatic experience for someone who's 6 months old, even though they may not remember. Another thing about trauma is, and here's some of the myths around PTSD, and I got that from the PTSD Alliance, is that PTSD, that you will be affected by a traumatic event immediately. And that's actually not true. I mean, a lot of people actually become affected within the first 3 months. They start to have these experiences, and I'll tell you about what the symptoms of PTSD are. But sometimes it happens years later, and so then it makes it very hard for you to know, wait, why am I experiencing this? What is it connected to? There's a lot of confusion when you're feeling traumatized, Another myth about PTSD is that only military veterans get PTSD. And while it's true that a lot of military veterans do get PTSD, yes, that book, The Body Keeps the Score, is excellent. I love that book. Bessel van der Kolk is amazing. Thank you, Dr. Goltz, for that. But while it's true, the reason why they get PTSD is it's kind of like that being near death, right? Like lack of that helplessness. And actually 70% of people experience a traumatic event. Trauma is just present everywhere. I think probably a lot of you in the room have probably experienced a traumatic event, and you may have had symptoms of PTSD. It's not just for veterans. And then the other is that PTSD is a weakness. It's a sign of weakness. You just need to get over it. That's not true at all. There are very many strong people that are just overwhelmed by the events that they have experienced. And so then they begin to experience three kinds of, kind of like when I think about trauma and PTSD, and the DSM kind of talks about it in this way too. And the DSM is the diagnostic criteria. It's how you diagnose. But one of the symptoms of PTSD is the intrusive recollections, so that reliving, that re-experiencing of memories of the traumatic event. That is one of the symptoms. So flashbacks, nightmares, intrusive thoughts, those are signs. That's one of the signs. The second kind of cluster of signs for PTSD is avoidance of reminder of trauma. All right. So there's emotional numbing, and that's where the alcohol comes in, drug use, avoiding things. And so in my experience, I've had PTSD several times in my life. And the last one was my husband just died in an accident in July of 2020. And so I still do. And I feel like I've really healed a lot, but I still continue to avoid things that remind me of the day that he died in an accident. It was a very traumatic kind of way that it happened. And, so I, I'll get like an intrusive thought sometimes. Like if I see, the police came to tell me that something had happened to him, and it was a Harris County sheriff. And so now when I see Harris County sheriff vehicles, my heart starts to race, and I'm just like, I get foggy headed, and it's really hard for me to see that still. This is 14 months later, that continues to be an issue for me. But some of the things that I used to avoid before, I don't have to do as much anymore. Like I can go to the restroom now, into the same restroom, and brush my teeth, which before that was like, I can't do it, so it's like, as time has gone, I've healed a lot. But it's just an example of what that avoidance looks like. I still don't sleep in our room though, so still a lot of trying to run away from those feelings. And then the third cluster is the inability to feel, right? And so when you can't selectively numb the bad and then keep the good feelings. So it will numb your ability to feel joy and pleasure, right? And so then I think that is what makes PTSD so connected also to depression, to feelings of depression, because it's like you're having these nightmares. It's really hard to be happy when you're feeling freaked out constantly and reliving what happened. And that you're constantly running away from things that remind you of that. You know what I mean? So then your life just becomes organized around, how can I avoid all these things that remind me of this terrible event? And then I can't feel happy either, and so I think those, just kind of to explain what that, trauma and PTSD kind of looks like. And I think that the trauma treatment, the last thing that I'll say about that is that trauma treatment is so much more about, it's not so much about retelling your story, even though I will tell you, if you ask anyone around me, everyone here has heard me say my story a million times and over and over. And, I've called, Dr. Riccardi and Dr. Gold's crying, and I, like, oh, this is terrible. And they've been wonderful. But, it's not just about telling your story over and over, but it's about trauma treatments. And this is Bessel van der Kolk, who wrote The Body Keeps the Score. It's about helping people to be here and now and to tolerate what they feel in the present, right? Because even though that happened for me 14 months ago, I feel so much now. Even talking to you right now, I have chills because I have these reminders. And so being able to, anything that can help you, those deep breaths that can help you to deal with the pain that you feel in the here and now, that is trauma treatment. Exercising, not drinking so much caffeine, talking to your friends, getting support, and going to therapy. And we'll be talking a lot more about therapy later, but those are the kinds of things that we need to be doing. And so it's not just therapy. It's not just, therapy is very, 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 very important. But it's almost like, I think that for me, it's become a lifestyle to take care of myself so I can handle the pain I feel on a daily basis, And so it's kind of like, do I get enough sleep? Am I going to be around people that, that are supportive to me and that I can also support, And so that's kind of what I have. I'm sure that there's, my colleagues have a lot of experience also in this, and they might want to share what this has brought up for them.
Okay, thank you so much, Dr. Blaine. So there is a question in the chat. I don't know if that's a question, but okay, so it said, how can we as a community create a more soothing environment to help depressed anxiety in a large spectrum? And if we were able to discover these technology, how can we implement rules that will stop it from having the addictive effect of things like regardless of posting or not posting the threat? So I don't know if that's something you guys want to address before we move forward.
I think I understood what the question said, and I'm reading. If I did it, I'm sorry. I was kind of reading into some of it, and I'm sure I'm not the only one that has an answer. But I think having a community that loves and supports you is super important. And that's not really addictive. It's just, it's healing and nurturing, and I understand what you're saying. Like, I don't think, so this is me personally, okay? I don't think there's anything that is more helpful than human connection, right? That feeling of I'm not alone, that feeling of someone will be there and they can't take my pain away, but they can help me carry it just by listening to me. I really think that if we become empathic towards each other, and it takes time, like these colleagues here that are sitting here right now know that to be a supportive friend, sometimes you're going to have to put aside your own agenda to listen to someone else. And you can't do that all the time, right? But that is how you create a community where you can help each other deal with the cards that life hands us, right? And so I've had, hours of being on Zoom and just, trying to work with some of my colleagues so that I'm not alone and feeling anxious with my own re-experiencing of things. Or I've had, phone calls needing support, or people just walking with me, and you have to have a community, because I can't impose this pain that I feel all the time onto one person. It's just too overwhelming for one person alone to support me. So I've got a group of people and I just take my turns, I'll call, Dr. Goals, then I'll call Dr. McCarty, and then I'll call someone else. And then I'll, and so just because I know that I'm so overwhelmed, I know that it'll overwhelm just one person. So it is a community. I love that you said that, because I think you're on to the idea of the community. And that's kind of what the first thing that came to mind.
I just wanted to add to Dr. Barrows-Lane. I absolutely agree with everything that you're saying as far as making sure that you have a very strong support system for yourself. And being a support system to others by making sure that if there is one, checking in on your own biases, your own opinions and ideas about mental health, really kind of putting those things in check. And if you're going to be a support system to someone else, understanding that, okay, if you have a certain opinion or idea about something, we need to kind of put it in check, put it aside for a minute, because how can I truly support someone else if I'm coming into it with my own ideas about what that person should be feeling or experiencing? We have to be able to allow other people to experience their circumstances and feel what they feel genuinely and authentically without us putting any ideas of what they should be feeling. So that's just a way, just creating safe spaces for people to really experience their life authentically, and being that listening ear just to say, okay, what do you need from me today? That may be all that you need to be to that person is, what do you need from me? And it could just be, I just need you to listen. Then that's all you need to do for that person. If they need more from you, they'll let you know, but just kind of keeping our own selves in check so that we can be an effective support system to other people as well.
Wow. Okay. Thank you so much. So I think we also do have questions coming in. So the next question, I'm just going to read from the Q&A. It says, how do we reach out? So that's reaching out to instructors. And how do we reach out? Okay, so I guess, was it answered already? Okay. Okay, so it was answered. Okay. All right, so then let's move on to the next question. So what about the topic of hiring more social workers and paramedics, people to treat patients who have a mental episode instead of police? So,
yeah. Okay. And so, it's probably, and I say this sadly, one of the worst, best or worst kept secrets in Houston. There are mobile assessment teams. There are crisis intervention teams that often do ride-alongs with our Houston Police Department, who can help de-escalate situations on scene and help folks get mental health care rather than being arrested and going to jail. Harris County Sheriff's Office instituted a couple of years ago a program where they have a number of the deputies have tablets that connect to clinical social workers and other clinicians at the Harris Center to help do assessment on the scene via the tablet, to speak with people on scene, to again help de-escalate situations, evaluate what's going on, and either help the person stay on scene or perhaps get transported for psychiatric care rather than going to emergency rooms or being arrested and going to jail. These are some community-wide efforts that are happening so that our police aren't put in the position of trying to be clinicians and do mental health assessment on the scene. Now, of course, these efforts are expanding. They're not, a fixture throughout HPD or throughout Harris County Sheriff's Office, but our government, our city and county government are investing more and more resources to expand these programs so that perhaps there will come a time when the person you interact with, if you are having a mental health crisis, is not a police officer. It would be a social worker or a paramedic who is trained in mental health or a clinician, rather than the traditional route of encountering law enforcement and perhaps being arrested in order to get mental health care, which is sadly what happens a lot in our community and also nationwide.
All right, thank you so much. So thank you so much for answering. So we're gonna move on. Okay, yeah, so we're gonna move on to our next question. And it is basically surrounding depression, especially now, there are some a lot of misinformation and stigma. And so how could you, just tell us about what depression is and how it affects individuals? And that's for Ms. Davis.
All right, thank you. So I'm trying to answer questions in the chat as well while we're also talking. But if I look like I'm a little bit distracted, because I want to make sure your questions are being answered. But I will definitely talk to you guys about depression. And the one thing I want to make sure that you understand that depression is a really big word that we hear. And depression can sometimes, the definition of it is sometimes very misunderstood. And it is different from just experience kind of your regular sadness based on some type of event or something that may have happened in your life. Depression is typically something that is a little bit more long lasting and has more of a significant impact on your functioning and ability to do your normal activities. So typically what it's called is major depressive disorder. It's very common, but it can also be a very serious medical illness. It affects how you feel. It affects the way you think. It can affect the way that you act. But the best thing to know is that it is something that is treatable. Like we were saying earlier, you can always do counseling. That's something that can help you understand your depression or the reason for your depression, which could also have some basis in biochemistry, like we were talking about before. There may be just some chemical imbalance. There could be some genetic imbalance to experiencing depression. But if you are having very overwhelming feelings of sadness or depressed mood, your mood is very down as compared to what's considered normal for you. You're having a loss of interest in your regular activities and things that you find pleasure in is usually a really big one. If you're like, okay, well, I normally do this activity every week and I just do not have the desire to do any of these things anymore, then that might be a little bit of a red flag. Changes in appetite. Sometimes we tend to think that overeating is the one that because we tend to, sometimes we can emotionally eat, right? So when emotional eating happens, we, have to kind of take it into consideration. But if there's significant weight loss or significant weight gain, and those changes can be a symptom of depression, trouble sleeping. And we talked about that earlier with anxiety, having difficulty sleeping, and sleep can kind of affect and your anxiety. Same with depression. If you're having changes in sleep, either sleeping too much or not sleeping enough. Again, different from what you would consider normal for you. But another key factor of depression that we tend to see is if there's a loss of hopelessness, if there's a loss of courage, and you're just kind of having these feelings that there's kind of your feelings of purpose are severely diminished. So again, I'm making that distinction between there being depression versus there being sad. So again, if Dr. Burroughs Lane, she expressed us and she shared us, and we appreciate her sharing with us her own story, but it's expected and normal and common to feel sadness based on an event or something that has happened in your life. Now, when it gets to the point where it's having some significant issues in your daily ability to function, being able to go to work and be productive, take care of children if you have kids, being able to do schoolwork, being able to just get up out of bed sometimes can just be difficult to do when you're experiencing depression. So those are the things to really kind of focus on. If you feel like that's been happening for a few weeks, then that's when we want to, okay, let's take a minute, maybe let's find that support system that we talked about before. Who's our support system? Let me talk to somebody like, is this normal? And one thing I do want to say, because sometimes you have that two different kind of differences in people. You have the people that experience something, they're like, well, doesn't everybody experience this? So you feel like what you're dealing with is normal. And then you have that other group of people that are like, this is only happening to me. This can't possibly be happening to anybody else but me. But having that support system where you can have those conversations and be transparent and vulnerable with people to say, well, this is what's happening to me. Is this normal in any sort of way? Maybe I need to get the attention and treatment for this particular thing that I may not be able to handle on my own. And that's where counseling can come in to really help with that. Speaking with a medical doctor about your depression is something that's common as well. So those are the kind of things, and I'll let you guys kind of share what your thoughts are as well about depression and how they can deal with that. And of course, I'm in counseling services, so you can always come to counseling services for those types of concerns.
All right. Thank you. I guess so we can move on to the next question. Thank you so much for the answer. I'm very positive that the audience are learning a lot from you guys, so thank you. So our next question will be for Dr. Goltz, and that is surrounding substance abuse. So what is substance abuse disorder, and how does it affect individuals as well as the loved ones of the individuals that have the disorder?
Great question. And some of this is what we've been talking about. We often use the terms substance abuse and substance use disorders interchangeably, but we're actually talking about two issues here. Lots of us have a bad day, or we're under stress, or, and we may use substances like, my go-to double espresso shot Americano. So that's like 6 espresso shots in a cup if it's a venti. And yeah, I know, I love it. or maybe beer or wine or alcohol or cigarettes. I'm a former smoker, to improve our mood, or maybe we think it makes us feel like our thoughts are more clear, or our day is going better, or our day will be going better. But when you begin to use that recurrently and consistently, and it begins to have consequences, we are definitely talking about abuse. And this applies to both legal substances, because caffeine and alcohol are legal, and, more illicit substances, marijuana, and heroin, so on, right? But when we begin to become mentally and physically dependent on those substances, where we're having trouble starting our day or going through our day without feeling mental and physical effects, that can begin to shift from abuse of a substance into substance use disorders, where there may be health risks, health threats, permanent disability or injury. You may hear family or friends or coworkers or supervisors really talking with you about the consequences of abusing these drugs, and they're beginning to, or substances, and they're really beginning to have an impact on how you do your daily life. The thing about, really any substance is, if you use it enough, frequently enough, in a sufficient amount, you're going to begin to develop a tolerance to it, which means you often can need more and more and more of it to get the same effect. And that's a lot of what we see when someone has what we refer to addiction, which would correspond to a substance use disorder. Now, I've heard a lot of people say, well, marijuana is from the earth, and nothing from the earth that's natural can be addictive. Well, you can be addicted to marijuana, just like I'm addicted, you heard it, to caffeine. And I know someone's probably going to talk about food addiction and food disorders. And so food, gummies, that's me. Probably have a 5-pound bag in the kitchen. So, those are some of the differences. But here's the thing. This is a medical condition. This is not a moral failing. Okay? We all use something to make us feel better or make our world make more sense. It's when you become dependent on it and there are consequences in your daily life that we really have to take a look at it and see how to intervene.
I love that, Dr. Goltz, because that whole thing about moral failing and shaming of ourselves and others, we're going to talk about this a little bit later when we talk about, the stigma around these issues. But, that was just beautifully.
Yeah, I love that too, because I think we all have to, if you really look at yourself in a non-judgmental way, or if you're thinking of someone you love, right? They've gone through something difficult and they're using something, anything to make them feel better, or to deal with their stressful life or whatever. You wouldn't hopefully judge them for that. You'd understand, they're doing it because they need it. Like, we all do the things that we do because they make us feel better. Like, none of us are trying to feel worse or make our life worse. So I love what you said, Dr. Goltz, and also Dr. McCarty had talked about anxiety is a normal thing. Like, if we can just normalize, we all just want to feel better, and when bad things happen, we will get anxiety or trauma, or we'll feel, have some depression. Like, none of this makes us a bad person. I think that whole idea of you're bad or weak, or how could you get help or whatever, that stigma, it really, I think, comes from not normalizing the normal. We're human beings. We're not perfect. And when things happen in life, we're going to have a reaction. Okay. So and substance use is one of them, and I saw a question in the chat, how do you best, and it's a much more complicated, I'm sure, discussion, but I feel like if you have a friend that's going through this or anything else, being a non-judgmental, like what Ms. Davis said, being a non-judgmental friend, you know what I mean? Like not being like, how could you, or judging them as moral failures or as they're not trying. And sometimes that happens, right? Sometimes people don't try their best, but none of us try our best all the time, So I think just being kind and accepting and non-judgmental of other people, I think that is where it has to start. And then I'm sure there's more to it than that.
Yes, and this is a whole other webinar, but hey, guess what? We don't all come to life experiences the same with the same resources. So we've got sexism, we've got racism, just, with their big foot on our neck. So when things happen to you, there's not an equal response, right? If you don't have the resources, especially for students, you're under so much additional stress being a student. If you have all these other weights around your neck, when things do happen, so if you feel like you are so just impacted by something, I mean, there are reasons for that. There's all kinds of social justice reasons and social justice issues that play into your individual mental health. So again, that's a whole other webinar, but just to throw that out there.
All right, thank you all so much. So for now, we're gonna just take 3 minutes break, and then to just have everybody do whatever, they'll take a break, and we'll come back in 3 minutes. So we put together a list of, resources for you guys, and you can go ahead and, just, they'll be on the screen for when we get back. So go ahead and just take a screenshot. All right, so the next question is about the importance of therapy and counseling, and just, the stigma surrounding it. So Dr. Lane, should you please go ahead and speak to us about therapy? Why is it important that, people, go to therapy?
Yeah, so I mean, therapy, it's people think about therapy and they think it's just you're talking to someone about your problems. And I'm like, I can talk to my friend about my problems, which I can, and you can. And, but therapy is not just about that. The wonderful thing about therapy is that therapists are trained to listen to you in such a way so that they reflect back to you what you're saying. So you hear yourself, what you're saying. It's like looking in the mirror. Sometimes we're not even aware of what we're thinking, what we're really feeling until we start talking out loud, and someone who is skilled at listening to us in a certain way reflects it back to us. So therapy, in my kind of my experience as receiving therapy, because I'm also a therapy client, I've been for years, because I think in order to be a good mental health practitioner, you also need to be doing your own work. But to me, therapy helps you build awareness of your own thoughts, your own emotions, and your own behaviors, and how your behavior impacts other people, because you create this relationship with the therapist, and you might be talking about, I really wonder why after I become friends with someone within like 2 weeks, they just stop talking to me, or, you know what I'm saying? And then in that kind of session, you can have that experience of someone saying, I'm experiencing you this certain way. What do you think about that? And it gives you some kind of insight and reflection into who you are and how you come across to others. That's one thing. Or it can help you understand, like, oh, wow, I have this pattern of anytime I ask someone for a favor and they don't immediately say yes, I pull back hurt, and I feel like, I don't trust it. So then it's helped it so that person can reflect back to you, just that you might be experiencing, maybe for very good reason, trust issues, or, and that might make it difficult for you to get help from other people because you're not even giving them the time. Like if they don't respond to you within 5 minutes, then it's over, that kind of thing. So therapy is about talking about your problems, but it's also about building awareness of who you are. And that's crucial. That is crucial. I will say that I've been doing therapy off and on for many years, but I was very steadily going for the last year and a half before my husband died. And I just, we built a relationship. And so then when this happened, I was ready to she knew our story. My therapist knew our story. I remember the first day she came back after he died and we were both crying and just couldn't believe it, because a lot of the work in therapy was, working with my husband, who I loved very much, but relationships are not, they're complex, right? And you're trying to deal with all these different, kind of desires and needs and all that stuff. And so I think having that already in place when I was just exploring myself, and then something happened, because life will happen, and having that already in place, I think is it can be part of having privilege, because you have to have the money to go to therapy, right? And I'm going to just acknowledge that right now. We do have counseling services at UHD that are free, right? Where you don't have to pay. And so so the other thing that therapy helps with is making changes to your thoughts and behaviors. So you have these certain thoughts that influence your behavior. So as you gain awareness, right, of your behavior and where does it come from, these kind of subconscious thoughts, well, then you can start making changes to your thoughts so that your behaviors and the way you feel and all this stuff is improved. So it's really about improving yourself. It's also about learning and practicing coping strategies. Therapists do this all the time. Think about, like, if you go to a doctor that is it's kind of specialist, like a pulmonologist, for example, and you're having some lung issue, and you've gone to all these other doctors, they haven't been able to help you because it's not really their area, and they know what they're doing, but they don't see this every single day, but you go to a pulmonologist and they're like, oh yeah, I know what's wrong. It's this, So with the therapist, it's not like we know everything, but we see things often enough that when someone comes and starts talking to us, and we start, it's kind of like you start getting a hunch, and you don't want to get ahead of the client, because the client's the one that has to have their own right responses to their own, but you start getting a hunch, and then we can more quickly help you kind of get to where you need to go than someone who's like starting from scratch, like literally has no idea, doesn't see this, and there's also psychoeducation, that can, therapists are trained on how, the emotions work, the mind works, and so just having like all of this, I've learned so much here, and it's been reiterated to me here, just listening to my colleagues speak too. And I'm so thankful for that expertise, that together, I think with our life experience, right, and with our training, we can partner up with you to help you, kind of get to where you need to go. So I think that therapy really is a partnership. You're the expert of your life, and then you've got someone who's an expert in these areas, and they're going to try to connect with you so that you together can reach these goals. And as far as the stigma of therapy, there is stigma in therapy. I think that there seems to be like an issue with asking for help, and that you shouldn't ask for help when you need it. And I mean, that comes from like feeling like we're not supposed to be human beings. Like, we have problems, we all have problems. And I think, it's very easy for me to say, and I can say that because that I go to therapy, because like, it's just, I'm sure I'm not the only one that does here, and so I think like not being willing to acknowledge the need for help. I think that people sometimes make us feel like you should be stronger than that. And that's just not fair. I will say that if you're in a situation like that if you're being stigmatized, or it's like, I would never dare ask for help because what would my parents say, or what would my sister say, or my friend, don't tell them. They don't need to know everything that's happening in your life. I mean, I've done a lot of that kind of stuff. When I need help and I'm going to do something that I know people are going to judge me for, I just don't tell them. I don't need their permission to do anything for myself, so, and then therapists are supposed to keep your information confidential. So if you were to run into your therapist at the store, your therapist has to pretend they don't know you. And unless you walk up to them and talk to them. So really no one has to know. It could be our little secret, And so like, it's just, there is stigma, but also you can set a boundary on what information you give to people around you so that you can access the help that you need. Anyone else wants to share?
I will add to the excellent advice that you've gotten here, that, especially in certain cultures and communities, there's this spirituality and religious piece where the stigma and the shaming comes from, why would you put your faith in another human being rather than turn it over to God? That's a very common saying where I'm from, and I'm a preacher's kid, right? So, what I will say is that, you may go to your pastor or your imam or, your rabbi or your religious officiary for spiritual and religious concerns, and they're specialists in that. Therapists and counselors are specialists in problems of living and ways of helping people in talk therapy, or even recognizing when someone may need medical management, of helping people in that way. And it's not in any way some deficit in faith, as a practitioner of a religious, practice. But it has, it's everything to do with you getting the right kind of help from the right kind of person. And in some ways, if it's helpful, certainly it's been helpful to people in my family and some of my clients to think that, just like medicine might have come from the universe or creator, so has therapy and counseling, ways of practice to help with the mind.
I just want to add to that. Absolutely, the spiritual component to it. I know there was a question kind of in the Q&A about why there's this stigma in African American and Hispanic communities. And a lot of time with those particular types of communities, they are predominantly Christian, Roman Catholic, and there's a stigma placed on it because of these religious qualities. So there's that part of it as well. But to add to what Dr. Goltz is saying, we have to also look at counseling as a form of treatment. We can look at it as an additional treatment, the same way you go to the doctor for treatment for a physical ailment. If you say, for instance, you have diabetes and you need medication as management for your diabetes, you go to your doctor, you get a prescription, you get treatment for it, you manage it, you get follow-up. Hey, where are your levels? Where are you with this particular concern? Therapy is a lot like that. You're going, yes, we're having conversation, we're talking about the emotional, the mental, but we're seeing what the kind of underlying things are, what's the root of it, where is it coming from, and how can we treat it? We're going to follow up on it, see where you are with it, and if there are any additional changes or adjustments we need to make to that treatment. Then there may come a time where that treatment then is no longer necessary. Depending on what you have going on, it may be short-term versus long-term. There's so many ways that treatment can work, but we have to understand that we have to treat ourselves the same way we would treat ourselves physically. The doctor has been given certain training and things like that to be able to provide you with treatment. Same thing for therapists. We have been given specific training to be able to deal with matters of living. So we don't question the authority of doctors. We just go to the doctor and get what we need. We have to get to that point where we go to the therapist to get what we need from therapy.
I saw a question on the chat as like, what kind of therapy, how do I know which therapy is best for me? And that's a really valid question. I think that's something you have to discuss. First of all, you when you're looking for a therapist, it's a vetting process, right? The most important thing with a therapist is how connected are you with them? That is like what makes it most successful, is that human connection, and so you have to call around, you go to Psychology Today, or you go to your insurance, kind of listing, and you call around, you look at their profiles, see which one stands out to you the most. I'm always looking for someone very warm and very compassionate sounding, right? And so I'm like, ooh, let me call. So then I call, and I start talking to them, and I see their tone of voice. Do I feel like I can click with them? And so that's step number one. And then it's like, well, how do you, what kind of treatment approaches do you have? And sometimes that, because sometimes depending on what you're dealing with, you can have a different modality that research has shown to be most helpful or more helpful for that, right? So I would say that there's a lot of research, lately here on trauma treatment, and that it's not the same. It really is not the same as treating other kinds of things. You know, it's not like it's, you know, it's just there's a different component to it, you know, and so you could say, here's what I'm dealing with. What treatment do you think that would work best for me? You know, like a lot of like the cognitive behavioral therapy. I mean, it is good in being able to make cognitive behavioral is great. I mean, there's a lot of research behind it. It's very, very good for anxiety, and it's good for PTSD, you know, but when you have like trauma that comes from like, you know, chronic issues, you know, it sometimes is not the best approach, right? And so you're going to want to talk to the clinician that you're talking, you know, and saying, you know, why do you think this approach would be good for what I'm dealing with? And then read about it, you know, and see if you feel like that's something that fits you. And so, you know, so that I would say that that's something you do in consultation with the clinician that you're talking to. It's like, here's what I'm dealing with. What are the options for this? Why do you think this is best for me? And I would say start there.
Another thing to add, I'm sorry, I want to add this really quickly, as far as like stigma and things like that, is advocating. One, to advocate for yourself. You know, it's okay for you to advocate for yourself, even with your therapist. And those are the questions that we're talking about, is asking those questions like, well, what is it that we're going to do to help me in this area? This is what I'm looking for. This is what I need. But you're literally advocating for yourself. And that may not be easy to do starting out, especially if you have difficulties with kind of standing up for yourself. But it is okay to ask questions to your therapist, to let your therapist know, hey, this is what I'm looking for. This is what I need. This is the, you know, I want you to look like this. I want you to sound like this. And just really advocate for yourself in all aspects of your life, but even in your therapy as well.
Yeah, because you'll have misunderstandings with your therapist. That will happen too. You know, a couple of weeks before my husband died, I had a misunderstanding with my own therapist. And I was like, oh my gosh, you know, like even me being a therapist, I was just like, I am tempted to just run, you know, because it was kind of a big misunderstanding. But I talked to my husband, who was also a therapist. He was a psychologist, worked on grief. I mean, it's such an irony. I'm like, I need you to get through losing you, you know. But I talked to him, and he was like, Liza, you know better. You know that you need to talk to her and not just run away like that, you know. So I was like, okay, it's awkward. I mean, it is awkward to have a little confrontation, and it's not rude, but it's just like a listen, that really bothered me what you said, blah blah blah. So I did. And I talked to her, and we repaired it. And it became more strong after that, because she was like, I'm so sorry. I feel so terrible about misunderstanding you. That was an empathic failure. And she even like teared up, and I was like, oh, don't, you know, like, it's okay. And then we fixed it, and it became stronger. And I'm so glad that we did that. So that advocacy for yourself can be uncomfortable, but it's also a healing experience when you're so used to no one caring about what you think and your feelings not mattering, and you tell someone this bothered me, and they're like, I am so sorry, and they're responsive. That is already a healing experience, so that next time you're going to need to confront someone else or advocate for something else, you will do it because you're used to having the responsive people in your life. So yeah, Ms. Davis, I totally agree with everything you said.
All right, so thank you all again. So I believe we will only have time for just one question. So we're gonna go ahead and start on that question, and that is that's for Ms. Davis. So will you please just talk to us about confidential student services and the counseling center that the counseling center offer, and how the best way to contact you?
Absolutely. So, and if you haven't already seen, I did include the information in the chat for you all to be able to access us. The link to the website, our specific website on the UHD website is there. We can be contacted by email or by phone. So counseling services is a little bit different in the way that we're doing things here at UHD. Previously, it was contracted through a third party, but now we're offering those services in-house, and we are specific to UHD students only. So when we talk about stigma and normalizing things, part of it is creating access. And that's kind of part of what we're doing here, is creating that access that you all need to services, to education, and the things that you are needing to be successful as students and to be successful as people. So moving forward, our new counseling services, we will be offering free confidential counseling services to all students who are enrolled at University of Houston Downtown. You can contact us, like I said, by email or by phone. The email is there. When you go to the website, there is also a contact form that you can fill out. It will have your phone number, your email. You can also leave a message saying, hey, this is the reason why I'm reaching out to request services. And we'll probably get back with you within about 24 to 48 hours so that we can try to set up an appointment with you. All of our services, like we were talking about, they are completely confidential. What you share with us in this room, because this is my office, this is my counseling room for myself. Everything that you share with me within this room is between you and I. That is not shared with your professors. It's not shared with your parents. It's not shared with anyone. So like we were saying before, you know, if there are other people in your life that you feel like are not on board with you receiving counseling, they don't have to know. That's between you and I. As adults, you are able to come and receive these services without anyone knowing. So definitely come and visit us. We're also located in South 280. We are, if you know where that is, there's the food market, and we're right around the corner from them. You'll see the double doors. Just come on in and visit us, and we can again get you set up, get you the services you need. If there's something that's more extensive than what we might be able to provide, we'll still have a conversation with you, see if our services are the best fit for you, or if there's a need for a referral to some other outside agency, then we're going to also try to make sure that we connect you to those services. So definitely be looking out for counseling services when it comes to awareness events, workshops, seminars. We are going to be doing a whole lot more of that. And sorry, the train is passing right now. But we will be offering more educational opportunities for you all to be able to learn about these different types of mental health related issues and to be able to receive the services here at UHD.
All right, I want to just thank you all for, our panelists. Thank you so much. I know it is because of you that we're able to do this today. So I really do, with all my heart, I really appreciate you all being here. And I also thank our audience for joining us. And if anyone, you want to give out a special word, just a closing statement, you can take the floor.
I think just very quickly that we talked about stigma so beautifully in a couple different ways. We have to be brave about this. We have to be brave about addressing stigma, and sometimes that feels uncomfortable. Every person has different abilities, and at some point in your life, you may have a different ability in lots of different areas, physically, emotionally, psychologically. We all have different abilities. And I can't remember who said it just beautifully about that's just the truth of how we are as human beings. So the more we embrace that, the more we embrace this just tapestry of humanity and the different abilities that we have in social work, we want people to have the same opportunities and access to opportunities. We're not there right now. And so our kindness, the opportunity to be kind as much as you can to other people and understanding as much as you can to yourself and to other people will help us push forward on being in a more caring society and to addressing the stigma that really holds us back. All it does is hold us back.
Yeah, I think that being brave, it's so crucial. And I think I'm trying to think of when did I start to be okay? Because at one point I was like, I can't go to a therapist. Years ago, I felt the same exact way. And I think when I began to lose judgment for myself and others. You know, when I began to the more I talk to people, the more I realize we all kind of struggle with the same things, you know, like I'm not the only one that deals with this. When we feel that we're isolated, like Ms. Davis said, you know, when we feel like we're isolated, and some people are like, well, everyone deals with this, and it's more easy for them to talk about things. If you feel like I'm the only one, this is a big secret. Once you start talking and really listening to other people, you'll begin to realize how not alone you are. And when you start to just lose the judgment, you know, it's just like, let go of the, I should be doing this. I mean, we all struggle with it, but it's a practice of being like, I'm not perfect. It is okay that I'm not perfect. You know, and we watch Wreck-It Ralph, and the bad guys are all sitting together and they're like, we're bad and that's good, you know, and it's just kind of like, we're not perfect and that's good and that is okay. And I think when you begin to lose judgment of others, and you can accept others, and you learn to start accepting yourself, I think and you start showing kindness to others, and you start expecting that in return, I feel like that also helps with courage. I think I feel is when you said the word brave, I'm like, that's when I started to be brave, was realizing I wasn't alone, and that if I'm cutting someone else slack for having problems, I'm going to also cut myself slack for having problems, because I'm human just as much as anyone else is.
I'm getting taken to, you know, like social work promised land on this. You know, one of the things that was said a long time ago when I first came to UHD, you know, there was a situation, and Dr. McCarty was talking with us and said something to the equivalent of, and I'll never forget this. She said, don't internalize something as normal when it's clearly just not, you know, and that always stuck with me, because when, you know, life is so full of conflict and aggression and rushing and pressure, and if we somehow internalize this and tell ourselves that this is the way it must be or should be, we're shortchanging ourselves. We are buying into this idea that the world can't change and we don't have a part in changing it. And to buy into stigma, mental health stigma, substance use stigma, even intellectual and developmental disability stigma, to buy into that is to shortchange ourselves and keep ourselves from reaching our full potential. So please, you know, I love that phrase, you know, don't say something's normal when it's not, because you do have power, you know, that you can leverage on your behalf and on behalf of others.
I just wanted to add to wrap up with you guys. One thing as a counselor and as a therapist, I always tell clients or students on a regular basis, give yourself permission to feel and to be exactly who you are and where you are. The more you give yourself permission to experience exactly what you're feeling, the more you start to normalize those feelings. So I'll leave you guys with that to take with you throughout, you know, kind of your dealings here at UHD.
All right, thank you again. Thanks to everyone for joining us and, you know, having this great discussion. This will be the end of the discussion, and I wish you all a wonderful weekend. Have a great time.